Let me just go over something real quick before we get to the update on the COVID-19 virus. I want to make a quick announcement this afternoon. I have declared a state of emergency for all counties south of I-20 due to inclement weather and severe flooding in those areas. Obviously, this has nothing to do with what the rest of the press conference is about, but I want to let the people of South Georgia know that we have done that. We've got some road issues and other infrastructure issues that we're seeing because of the brunt and level of rainfall that we've had and flooding that's going on. We're working with GEMA to ensure that these communities have all the tools and resources that they need to deal with this fallout, and we will continue to keep you updated. I know Director Bryson from Georgia Emergency Management Agency is here with us today. He can answer any specific questions when we wrap up for you, and they will have more information coming out here in just a little bit in regards to that and your local emergency management folks back home. I certainly know there's been a lot of concern in the media the last few days, but again, I want to continue to emphasize that this is still no time for Georgians to panic. We have no additional cases at this time. Dr. Toomey, my team, and members of the coronavirus task force are in constant communication with partners across all levels of government. I want to thank many of them for being with us today. As you know, I have spoken to the Vice President multiple times. As he continues to roll out information, this is the latest that we have. There are more than 100 confirmed cases in the United States. They're a mix of those who were repatriated into the country and then those that have contacted it in the country. The Vice President continues to stress, as we do, that the risk for the American public remains low of contracting the COVID-19. And we encourage people to continue to use common sense practices just like they would during a normal flu season. Washing their hands, staying at home if you're sick. Don't feel like you have to go out and buy masks and other things that will not help you. So there's a lot of information on the CDC's website about those type things, and we just want people to be very smart about what they're doing. The federal government has suspended all travel from Iran and China and has implemented this highest level of travel advisories for northern Italy and South Korea. I specifically spoke to Vice President Pence about this late yesterday afternoon, and John Selden, who's with us from the airport, will make some remarks and address some of that briefly here in just a few minutes. All direct flights from South Korea and Italy into the United States have multiple screens conducted before boarding those planes in accordance to directives from the State Department. And like all of you, I'm proud to say that our state lab now has the capacity to conduct the COVID-19 testing, which actually started today. More than 2,500 kits have already been distributed to the states. That accounts for more than 1.5 million tests being available, and commercial labs will begin ramping up their own testing next week. As of today, the Department of Public Health has started processing these kits in the lab, and as you know, that has been done a day ahead of where we originally predicted that to be, which was tomorrow. Good news out of Washington today: the U.S. Senate has now passed the supplemental budget, the emergency funding bill, with $8.3 billion designed for funding for state and local jurisdictions to help fight the situation that we are currently in across the country. In addition, CMS has released new guidance for hospitals, nursing homes, and nursing home surveyors to prioritize infection protocols for nursing homes. I know this is something that everyone has been concerned about, and obviously for those that have friends and loved ones in those facilities, the federal government and the Vice President, under the direction of the task force, have directly addressed this. CMS has also designated COVID-19 testing as an essential health benefit, which makes testing more easily available to all Americans on Medicaid, Medicare, and commercial health insurance. As I have said before, we have to be vigilant for vulnerable populations and for coronavirus. We know that the elderly and those with pre-existing conditions are the ones that are most at risk. In addition, when you look at the data from South Korea, we know that there have been no deaths among individuals under the age of 30. In Italy, the average age for those who have become sick with COVID-19 is 60, and the average age for any deaths is 81. As you know, members of the public continue to be eager for timely information about coronavirus. In addition to all the health-related guidance that officials are issuing to keep people properly informed, it is equally important for people to be on the lookout for scams. Yesterday, Attorney General Chris Carr, who is with us today as well, and I issued guidance to Georgians to be on the lookout for scams and hoaxes, because con artists are always ready to take advantage of people in times of need. General Carr is glad to address any specific questions that you have when we wrap up. I hope that you'll please continue to share the message to the most reliable, the message that the most reliable and up-to-date information is coming from the governor's office and this task force and the Department of Public Health, as well as the federal information that's coming out from CDC and others. I want to continue to encourage my fellow citizens to remain vigilant in your communities and encourage, remain calm, and continue to use best practices. And with that, I'm going to turn it over to John Selden, who's the General Manager of Hartsfield-Jackson International Airport, and he can give you a quick briefing on the operations that are going on in Atlanta. John?
We're just listening in to Governor Kemp as he gave a press conference with an update on the coronavirus here in Georgia. The most important thing that he said is that Georgians don't panic. There are no additional cases at this time.
That was the key headline from this press conference. Also, the fact that labs here in Georgia, state labs, will now be able to begin. They have the capacity and the ability to begin testing right here in the state of Georgia. Of course, we're going to continue to follow this. If the governor says anything else that you need to know, we'll pass it along. We've got a lot more straight ahead on CBS 46 News at